Hi, so welcome to Doctors of Medicine. I am yours, Ngonzeshe Zimbwa. We are continuing with our lower limb lectures. So today we are going to talk about the anterior compartment of the thigh. Right. So as you can see right over there, that is your thigh region. So your thigh region is divided into three compartments. We have the anterior compartment, we have the medial compartment, we have the posterior compartment. And these compartments, they are divided by what we call muscular septa. So around this thigh, we have a deep fascia, which is called fascia lata. So the fascia lata is going to send some fibers to attach to the linea aspera of the femur. So the attachment of these fibers to this linea aspera, the lateral linea aspera, the medial linea aspera, it will divide it will divide the thigh into compartments. The anterior compartment, which is also called the extensor compartment, because it extends the knee and it flexes the hip joint. And then we have the medial compartment, which is called the adductor compartment, which is responsible for adduction, which is the movement of the thigh towards the midline. And we have the posterior compartment, which is also called the hamstring compartment, which is also called the flexor compartment, that is responsible for the flexion of the knee as well as the extension of the hip joint. So now let us get deep into the anterior compartment. So the anterior compartment, as you can see as I am zooming right there, it is made up of the following muscles. So it is made up of the iliopsoas muscle, right? We understand that the iliopsoas muscle, it's a muscle which is made up of the psoas major and the iliacus muscle. So the psoas major muscle is highlighted there. Is a muscle that is originating from the lumbar vertebrae, or let me say specifically from T12 to L5, the lumbar vertebrae, the bodies, the transverse process, as well as the intervertebral disc of T12 to L5. Then it's going to descend, and it's also a special muscle which in relation to the lumbar plexus, we understand that the lumbar plexus is formed in the substance of what? Of the psoas major. The psoas major is going to descend downward or inferiorly, and then it's going to be attached to the tendon of the iliacus muscle, forming the iliopsoas tendon. So this iliopsoas tendon is going to attach to the lesser trochanter of the femur. So this is your iliopsoas muscle. For the innervation of the iliopsoas muscle, the iliacus muscle specifically, it is supplied by the femoral nerve, but the psoas major is supplied by the anterior rami of L2 and L3. You need to take note of that. It is not supplied specifically by the femoral nerve, but is supplied by anterior rami of L2 to L3. So that's your iliopsoas. This is your psoas major, your iliopsoas. Both of them, they're called iliopsoas. They attach to the lesser trochanter of the femur. So another part of the anterior compartment, another muscle of the anterior compartment is this one. This one that is called the pectineus. So the pectineus muscle, it is a unique muscle because it's found in the anterior compartment. Depending on the text that you're using, some they can put it in the medial compartment because it has two actions. It is it flexes the hip joint as well as adducting the hip joint. So it's also found in the adductor compartment as well as the anterior compartment. This pectineus muscle is supplied by the anterior branch of the obturator nerve, right? So yeah, so that's the pectineus muscle. So then we go to the main muscles of the anterior compartment. So as you can see, we have a special muscle, this one, that is the sartorius muscle. The sartorius muscle, as you can see, it stretches downward, right? And then it will attach to the proximal medial portion of the tibia, as you can see here. And where it attaches, it will be accompanied by the gracilis as well as the semitendinous muscle. So the sartorius, moving from anterior to posterior, we have the sartorius, we have the gracilis as well, the gracilis, and we have the semitendinous. The three of them, they form the pes antennas, right? So the sartorius muscle, it originates from the superior iliac spine. So as you can see, it originates here, the superior iliac spine, right? And then it attaches the proximal medial third of the tibia. This is the longest muscle in the body. It is a straight muscle. It is about 40 centimeters long, and it is responsible for 5 main actions. 5 main actions. So let us move with the sartorius, the actions of the sartorius. So as you can see here, the sartorius, it attaches to this anterior iliac, to the anterior superior iliac spine. It crosses the hip joint as well as crossing the knee joint. You see? So it means it has action on the knee joint as well as action on the hip joint. So what are the actions of the sartorius on the knee joint, on the hip joint? Let's start with the hip joint, right? Right. So at the hip joint, it has 3 actions. 3 actions. 1, it flexes the hip joint. Since it is in the anterior compartment of the thigh, where we find flexus, it's a part of flexus. It flexes the hip, the hip joint. 2, it causes a lateral rotation of the hip joint. 3, it causes abduction. So it is an abductor. So those are the actions of the sartorius at the hip joint. Let's go to the knee. So at the knee, we said it is attaching to the proximal medial portion of the tibia, as you can see over there. So since it's attaching here, when it contracts, it's going to cause flexion of the knee. So it causes a flexion of the hip joint as well as a flexion of the knee, right? And then it also causes a medial rotation of the knee. Medial rotation of the knee. So those are 5 actions of the sartorius. At the hip joint, we said lateral rotation of the hip joint, abduction of the hip joint, as well as flexion of the hip joint. At the knee, it is responsible for medial rotation of the knee as well as flexion of the knee. So that is the action of the sartorius. That's the action of the sartorius. Right. So let us hide the sartorius and let us see what is behind it. So behind the sartorius, we have 4 groups of muscle, right? Okay. I have to mention this, that the sartorius at its upper half, it forms the lateral border of the femoral triangle, and at its lower half, it forms the anterior medial border of the subsartorius or the adductor or the Handes canal. Very important. And then later the sartorius, it is going to be pierced by the intermediate nerve of which is a cutaneous nerve from the femoral nerve. So when the intermediate cutaneous nerve from the femoral nerve, which is a branch of the anterior femoral nerve, it's going to pierce the sartorius as it enters the deep fascia to supply the skin of the anterior portion of the thigh. Is it good? So that's another thing that is very important about the sartorius. So let us now hide the sartorius. Now let us go to the quadricep muscles. Quadricep muscles. You need to take note of these ones. The quadricep muscles. Let me try to zoom so that you can see. The quadricep muscles, Right. So it's made up of four muscles. So moving from lateral to medial, this muscle is your lateralis, your vastus lateralis, and then this one, which is a bit superficial, is your rectus femoris. And then this one, which is the most medial portion of the quadricep muscle, that's your vastus medialis. And then if we are going to hide the rectus femoris, we are going to appreciate the vastus intermedialis. You see that one, the vastus medialis. So the four of them, see there, that's your rectus femoris. So the rectus femoris, its origin, it originates from two heads. It has a reflected head as well as a straight head. So let's see if we can see the reflected head and the straight head of the rectus femoris. Okay. So right here is a rectus femoris. So if I am to zoom in, okay, so you're going to discover that it is a straight head and a reflected head, right? So the straight head is going to attach to the anterior inferior iliac spine, right? And then the reflected head is going to attach to the groove above the acetabulum, right? And then it's going to descend downwards as it attached to the base of the patella via the quadricep tendon. So you need to take note of this. In the anterior compartment, we only have two muscles. Mind this, two muscles that crosses the hip joint as well as the knee joint. One of it is the sartorius, the second of it is the rectus femoris. And the rectus femoris being the only muscle in the quadricep group that crosses the hip joint. I think you're getting it right. So which means its action is going to have actions on the hip joint, right? And action on the knee joint. Is it? So as you can see, let's go to the action on the hip joint. So here is your hip joint here. So the hip joint, the rectus femoris on the hip joint is going to facilitate flexion of the hip joint. Flexion of the hip joint, right? And then on the knee, the rectus femoris is going to cause extension of the knee, right? So that is about the rectus femoris. And the rectus femoris is supplied by the femoral nerve. Femoral nerve. Done. Done. Now, we go to the... Alright, so that's is your vastus lateralis. So vastus lateralis, it originates from the upper end of the femur. And it's going to insert right on the patella via the quadricep tendon. But more specifically, if we're going to look at the patella is triangular in shape, right? This is your patella, right? It's triangular in shape. So you're going to discover specifically that the vastus lateralis, it is going to attach, because the patella is triangular in shape, is going to be divided into, this will be your base of the patella, right? This will be your medial body of the patella and the lateral body of the patella. So the vastus lateralis, it will attach to two-thirds of the base of the patella and 1/3 of the lateral body of the patella, specifically, right? So what is its function? We know that's flexion. Its nerve supply, femoral nerve. Done. That's your vastus lateralis. Then we go to the vastus intermedialis. This is your vastus intermedialis. Your vastus intermedialis, it originates from the upper end of the femur, and then it attaches to the base of the patella as well via the quadricep tendon. This vastus intermedialis is very important because it's going to give the deep fibers of the quadricep tendon, while the rectus femoris is giving superficial fibers of the quadricep tendon. Done. behind. And it's also important that the vastus intermedialis is going to have a detached branch or detached fibers that are called articularis genus. Let me see if we can find them here. These ones. That's the articularis genus. The articularis genus, these are detached fibers of the vastus intermedialis that will attach the suprapatellar, the suprapatellar basa of the what? Of the knee. Very important. Now we go to the vastus medialis. So right here, this is your beautiful muscle. That's your vastus medialis. Vastus medialis originating where? From the what? From the upper end of the shaft, and then it's going to attach. This one is very important because it's going to attach to the upper third of the base of the femur, base of the patella, and the medial 2/3 of the patella. The fibers of the vastus medialis, they are lower than the fibers of the lateralis. This is because that the fibers of the vastus medialis, they will not attach via a tendon, but they would attach directly to the medial aspect of the patella, forming what we call vastus medialis obliquus muscles. So the vastus medialis obliquus muscle, they are important for keeping the patella on the patellar surface of the femur. All right. So if we can see here, let's see this other side. I think it will be easier. Let's go to the other side so that I can explain. Right. So this is your vastus medialis, rectus femoris, vastus lateralis, right? So what happens? The combination of these muscles, this is the quadriceps femoris. So this is the quadriceps muscles, right? So these quadriceps muscles, right, when they contract, they are going to contract the pulling the patella superolaterally. So they pull it in this direction, superolaterally, thereby sort of like pulling the patella laterally. So the patella has to be reinforced within the joint, the knee joint, so that it will not move out of the knee joint. So there are three important marks or landmarks that facilitates the stability of the patella within the knee joint. The first one being the fibers of the vastus medialis, that we say the vastus medialis obliquus. This one, when the vastus lateralis, when the quadriceps femoris, when the quadriceps muscle is pulling superomedially, the vastus medialis is going to pull the patella to the medial side, right, like this. And then the third one is the prominency of the lateral condyle of the femur, and then the fourth one is we are going to do the knee later, is the medial retinacular ligament of the of the knee. So those three landmarks, they keep the patella on the patellar surface. Is it? So these are your quadriceps muscles. So the quadriceps muscles, they will attach at the base of the patella, as you can see over there, via the quadriceps tendon, and then they will also attach to the tibial tuberosity via the what we call the patella, the patellar ligament, or the ligamente patellae. Yeah. So they will attach there, as you can see, via that tendon.